ASU researchers are part of a national study looking at advancing personalized cancer detection and treatment. The goal is to better find out how and why cancer spreads and mutates. And to learn more, we welcome Ken Buetow, director of ASU Center for Evolution and Medicine. Welcome to Arizona Horizon. Good to have you here.
Thank you for having me.
You betcha. All right, so this is, I kind of gave a general thing here, identifying what makes cancer so cancerous.
Well, and indeed, we all are familiar with people who, we've all had a personal experience with people who've gotten cancer. And we've made tremendous progress in the last decade and a half with personalized medicine, treating the cancers and the molecular characteristics. But we also know that a fair number of people, unfortunately, have the cancer come back, even if they've had remission or suddenly the cancer treatment starts working. The purpose of this research program is to literally identify what is the underlying mechanisms that cause the cancer to be able to evade the treatments, and then use those to have next generation targeted therapies.
So the underlying mechanism that allows you to fight the cancer and to get it into remission may not be the same mechanism that keeps it away.
Absolutely. What we've seen with, again, a decade of doing next generation genomic characterizations and molecular profiling tumors is that we can do a good job of characterizing the initial state of the cancer, but what happens is the cancer changes over time. It changes in response to the particular therapies that we're using, and in the goal of this research program is to identify how it changes and then to utilize those changes to direct our next therapy.
Does it change, let's say that something affects one side of the body and then it metastasizes and you've got the other side of the body affecting, different organs are affected. Does the cancer involved, is it all the same? Does it mutate the same? Is the genetic component the same?
No, and that's part of the challenge that we face is that the cancer itself is rapidly changing all the time in response to the body's attempt to fight it, as well as whatever we do in our treatments. And what we're really attempting to do here is essentially embrace the Wayne Gretzky strategy of cancer therapy. So rather than treating the cancer we see today, what we want to do is characterize the tumor and then evaluate where we think the tumor is going and use that as our tools to direct our next therapies.
Yeah, see the play before it happens, in other words.
Exactly.
And it's a $142 million federal grant. You're working with some pretty big institutions here, MIT and Stanford and such. And the focus at ASU sounds like it's computer modeling, something along those lines?
Indeed. Our goal in the ASU-funded portion of this program is to literally be the group that identifies how is it that cancer is resisting the treatment. What are the specific molecular mechanisms that the cancer uses? And we're using state-of-the-art computational methods. We're bringing to bear all the state-of-the-art genomics analysis and, of course, machine learning and artificial intelligence approaches as well.
The state-of-the-art situation that you talked about there, obviously you're doing research to improve that. How far along is the state-of-the-art right now?
We have preliminary clues that are what we're using to start with. But to be honest, one of the things that's really novel about this particular research program through ARPA-H, Advanced Research Projects Agency, is that we're going to be studying and collecting molecular samples over time with cancer patients. So we're going to have a absolutely novel collection of material for our statistical and computational model.
And again, this is tumor evolution, this is molecular resistance, and all this kind of business. And this is by way of clinical trials?
So embedded in this particular research program is a clinical trial. So not only will we be doing the basic science research in real time, but in real time, the findings that we're having in our basic research will be applied in a clinical trial to we believe, to save lives, to actually redirect the paradigm of how cancer is being treated.
Wow, that sounds very exciting. And Mayo Clinic teams are involved with this?
So it's we have a collection from a variety of different groups, our new American University partnerships at ASU, from multiple different departments of School of Complex Adaptive Systems. We have people from the Biodesign Institute, but then also we have a long-standing relationship with our colleagues at Mayo Clinic, both in Mayo Mayo Clinic Arizona and Mayo Clinic Rochester.
So last question here. This
Sure.
142 million, it's spread all out. You guys are going to get your share to do
Yep.
your computer modeling in
Yep.
the clinical trial. But MIT, Stanford,
Yep.
UCSD, I think Brigham and Women's Hospital,
Yep.
also involved.
Yep.
There's got to be a sharing, a collaboration here.
Oh, and that's one of the really cool things about this. So we're creating, as part of this broader program, a platform where all of the data that's being generated as this can be shared among all the participants, but more importantly, will ultimately be shared with the much broader research community.
I was going to ask about that data.
Yep.
Where does it go from here?
Yep. The idea is that what we hope is that this will just be the foundation of a whole new generation of new cancer therapeutics.
Well, it certainly sounds encouraging. Ken Buetow, again, ASU Center for Evolution and Medicine. Good luck. We're all rooting for you.
Thank you.